Speaking of the biggest areas where these models can make a difference, looking into the future, what is your kind of dream area that you hope to see more research done or more work done when it comes to artificial intelligence and oncology? Is there anything that you're super excited about, more work being done
Um,
on?
I'm particularly, I mean, this may be motivated by my research focus, but I'm particularly interested in continuing to explore how digital pathology as well as multimodal data can help us to better personalize treatment. As similar to the era of when gene expression technology and sequencing technology became more widespread, we were able to better distinguish different expression-based subtypes of breast cancer that has formed the foundation of a lot of science that we've gotten that has brought us to the current day. And I think that similarly, we can gain uh, sort of somewhat related, but also distinct insights about biology from digital tumor images that will allow us to, like I said, I think in a few years we've seen a lot of this interesting data today, but I think in a few years we will see digital pathology risk tools that potentially perform better than our existing genomic testing, and then using these in a orthogonal fashion will allow us to better select patients for chemotherapy, and better select patients for the many other therapies that are in development today, cell cycle inhibitors, and other targeted treatments. Um, I think that one of the biggest barriers or the challenges here is that accessibility to data. And I'm a big believer that we need to have robust data sharing to ensure that we can work together as a scientific community to understand mechanisms of response and resistance to treatment that can only be learned from analysis of many, many patient samples. And I think that I don't have a solution to that, but I think that's kind of a challenge to the research community. I think that thankfully most of the large academic oncology cooperative groups are very good at this and are enabling the development of many of these next generation tools. But when it comes to a lot of the drug development is also done by drug companies who do a lot of great correlative science and also make the next generation of therapeutics available to patients. But I do think that whether it's federally or in some other way, um, accumulating data from vast number of patients across multiple dimensions, digital pathology, as well as genomics and others, will allow us to build models that really help us to be able to select right treatments for the right patients, um, to allow for really personalized precision medicine. Because we've talked about, I think, precision medicine for in oncology for a long time, and still so much of the treatment that we give is really based off of very broad groups of patients. And I think a lot of that is due to if we could get the data. I think that's the biggest challenge facing AI is to get enough data to build the models that we need to answer the important clinical questions. So I think we are making progress. There's a lot of different initiatives that will facilitate this progress, but I think uh, as we get better data and multimodal AI, I think we'll start to see how much it can be integrated into patient treatment.
Wonderful. Well, this has been an amazing conversation. Dr. Howard, thank you so much for joining us here on MD Newsline Podcast. It's been a pleasure.
Thanks again. It's been a pleasure.